This is all part of the trauma sim range that's manufactured over in Perth. It's fantastic training equipment. We use this a lot in our sort of high-end courses there, guys, but just want to show you how effective the bandage is. Once they're firmly applied, again, we just ask you to pump that bulb until that bleed has been controlled. The firmer that you actually apply the rescue bandage, so when you use it, consider that fact as a bandage. You know, it's firmly wrapped around. The firm that you can wrap it, the more instant the result is when you start to hit with the inflation bulb. There's a couple of features here about the management of traumatic limb injury there. Our first focus and approach is to control arterial bleeding. So we're well and truly aware, guys, of both arterial and venous bleeding. Is that right, folks? That occurs. But I also want to show you this. The third bleed that we actually get when you have a limb that's sheared off is what's called medullary bleeding. And this is where your blood is produced within the medullary cavity in all long bones. So our first objective is to shut down the high pressure hoses. Is that right, folks? Yep. Get that arterial under control. And then we'll need you to move then and then start to deal with this medullary bleeding. And again, you'll only ever see this with any long bone. Is that okay? That's gone straight through. It's not the full bone, but in here, guys, we just need you to move in and then start wound packing. If you ever see anything like that. So I haven't got too much medullary cavity, but you get the concept that that's what I need to do. Get in there and pack to tap that off. They're not a tremendous bleeder, but they're a leaker. Is that all right, guys? When you see that bone shattered through. I'm just going to finish the stump there, guys, with the use of the emergency bandage, the Israeli bandage. If you've seen these large ones, these ones are actually designed for open abdominal injuries, burns. And you'll see that the pad in the end is actually lined with plastic. So if you've got open abdominals, leave the plastic in place and around. Is that all right, guys? If you've got a bleeder, that plastic layer is designed to be ripped away. That's that plastic layer here that I was saying. And if you don't need it, that's designed to be ripped away. Now I've got some serious pressure in that tank. I've taken it to its highest pressure. And I just wanted to show you that this is where we are currently with those ARC guidelines. Now this is what it's asking you here, is that I had no option but to tourniquet immediately. Is that all right, guys, to control that bleed? Then I moved in and I looked after secondary bleed and I went into stump care, and then they want you to do an assessment, do we have control of that bleed? And if I still have no control of that bleed, they want us to check the first tourniquet, and if needed, to co-locate a second tourniquet. Now when we co-locate a second tourniquet, don't leave a gap in between. That gappage in here, you run the risk of inducing potential compartment syndrome. Is that right, guys? So they've got to be co-located as close as possible. That's what I'm saying, it's that you wrap it, firm, Velcro, inflate, and reassess bleed. All good, guys? So we're going to invite you to come around and have a play with this. So we'll get you on the bleeders here, and you can take some of these here on the post. There's another one here that I wanted to show you just for a demonstration purpose. Guys, I've got two of these pulse oximeters, and these ones here, it's not only SpO2 readings and a heart rate reading, but along the bottom here, you also have a perfusion graph. The perfusion graph is monitoring blood pressure. It doesn't give you blood pressure readings, but every time you see a little dip on that bottom perfusion graph, that's your aortic valve closing. Is that all right, guys? And then it's sort of just picking up on systolics and diastolics. But you'll see how effective that once you've got this on, you have that on a person's finger, and when you pump, you'll see that perfusion graph disappear. Is that okay? There's no blood pressure there at all. Can I just, it's hard, but I'll get you to come around and have a play. Black strip up. It's a firm wrap. And we're watching here, guys. We're just watching on that perfusion graph. Heart rate's gone, Sats is gone. And we've got no radial pulse. The other one drops out straight away. Is that flat line? Come around, please. Yeah, it's so firm. And, you know, the firmer, or what I regard the tighter, the more the immediate result. Yes, yes. You need that bladder as flat, 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 flat. And see how quick that stopped, you know, the firmer that you wrap it.